Thanks for joining us today. We're going to take a look inside of our amazing bodies to talk about an aspect of the cardiovascular system. This video addresses an essential aspect of maintaining good health. That said, we're going to learn about high blood pressure, what it is, why it matters, and how to keep our hearts healthy. Our bodies are like busy cities, and our heart is the main station, pumping energy everywhere. High blood pressure can be a tricky challenge, but with the right info, we can protect our health and keep exploring. Ready to learn about health? Let's go. Let's start our journey. Imagine your body as a vast and intricate landscape, crisscrossed with tiny, life-giving rivers. These rivers aren't filled with water, but with something much more precious, your blood. These are your blood vessels, a complex network of pathways that reach every corner of your body, from the top of your head to the tips of your toes. They're the highways and byways of your internal world, and at the heart of this system, quite literally, is your heart. Think of it as the powerful pump that keeps everything flowing smoothly. It's a tireless worker, beating day and night without ever taking a break. It's constantly pushing blood through these vessels, delivering vital oxygen and nutrients to all your organs and tissues. This continuous circulation is what keeps you alive and functioning. Blood pressure is essentially the force of this blood as it presses against the walls of your blood vessels. It's a crucial measure of how well your circulatory system is working. You can think of it like the water flowing through a garden hose. The pressure determines how strongly the water sprays out. Now, imagine if the hose gets squeezed or partially blocked. The pressure inside the hose would naturally go up, right? The water would spray out with much more force. High blood pressure or hypertension means that the force of your blood against your artery walls is consistently too strong. It's not just a temporary spike, it's a persistent condition that puts extra strain on your heart and blood vessels all the time. Doctors use a special device to measure this pressure, giving you two numbers that tell a story about your heart's health. The top number, called systolic pressure, represents the pressure when your heart contracts and beats, pushing blood out. The bottom number, diastolic pressure, indicates the pressure when your heart relaxes between beats, refilling with blood. Generally, a normal and healthy blood pressure reading is around 120 over 80 millimeters of mercury, mmHg. However, if your blood pressure consistently reads above 130 over 80, then you may be diagnosed with high blood pressure, and it's time to take action. The tricky thing about high blood pressure is that you usually can't feel it. It often has no noticeable symptoms. That's why regular monitoring and knowing your numbers is so important. It helps you stay informed and on the right path toward a healthier you. Think of checking your blood pressure as being similar to checking your map on a journey. It's very important for navigating the road to good health and well-being. All right, are you ready for a challenge? Today, we're diving deep to bust some common myths about high blood pressure. High blood pressure or hypertension is a serious condition, and it's important to separate fact from fiction. Myth 1, you can always feel it. Many people believe that if their blood pressure is high, they'll experience obvious symptoms. Nope, that's a widespread misconception. Most people feel perfectly fine, even with elevated blood pressure. That's why regular checks with a healthcare professional are absolutely key to staying informed about your health. Don't wait for symptoms to appear. Myth 2, only nervous people get it. Some think that high blood pressure is solely a result of stress or anxiety. Not true. It's far more complex than that. Anyone can have high blood pressure, regardless of their personality or stress levels. Factors like genetics, diet, and lifestyle play significant roles. Myth 3, if my medicine works, I can stop taking it. This is a dangerous assumption that could have serious consequences. Wrong. A big mistake. Medicine helps keep your blood pressure within a safe range. Never discontinue medication without consulting your doctor. They will guide you on the best course of action for your health. Fact: too much salt raises blood pressure. Sodium intake has a direct impact on blood pressure levels. Many processed and packaged foods have hidden salt, often in surprisingly high amounts. So, become a label detective. Read nutrition labels carefully and choose lower sodium options whenever possible to support healthy blood pressure. Eating less salt and diligently following your doctor's advice are essential explorer skills on your journey to better health. Great job, you're doing fantastic. Myth busting complete. You've successfully navigated the world of high blood pressure myths. Let's keep learning and exploring new ways to stay healthy and informed. What exactly causes high blood pressure? It's a question many people ask, and the answer isn't always straightforward. Sometimes a significant factor is family history. If high blood pressure runs in your family, you might be predisposed to it as well, or it could simply be getting older. The natural aging process can increase your risk. These are factors we can't change, unfortunately. But the good news is that our choices matter too. We have more control than we might think. Eating lots of salty, fatty, or sugary foods on a regular basis can significantly impact your blood pressure. These types of foods contribute to plaque buildup and arterial stiffness, and not moving enough, leading a sedentary lifestyle, can also contribute to elevated blood pressure levels. Smoking, of course, is a major risk factor for a multitude of health problems, including high blood pressure, or drinking too much alcohol can also negatively affect your cardiovascular system and raise blood pressure. Moderation is key. All of these lifestyle factors can contribute to raising blood pressure over time. Other underlying health conditions, sometimes seemingly unrelated, like diabetes, which affects blood sugar, or kidney disease, which impacts fluid balance, can also play a significant part in the development of hypertension. It's all interconnected. The good news, however, is that there's hope. We can actively choose healthy paths, making conscious decisions that benefit our well-being. This includes things like eating better, incorporating more fruits and vegetables into our diet, and moving more, engaging in regular physical activity. These positive changes can significantly lower our risk of developing or worsening high blood pressure. Regular checkups with your healthcare provider help your doctor see your whole health map, allowing them to identify potential issues early on. Knowing the causes of high blood pressure helps us make smart choices every day, empowering us to take control of our health. We're in control of so much more than we realize. We're in control of many parts of our health adventure. It's a journey, not a destination. Let's keep exploring and learning how to stay healthy and live a long, fulfilling life. High blood pressure is called the silent sneaker because you usually can't feel it. Most people have no symptoms even when their numbers are high. Rarely, if blood pressure spikes very high, you might get a headache or nosebleed. If that happens, get help fast. But don't wait for symptoms. The only way to know is to get checked by a doctor or nurse. It's a quick, painless test, like a secret decoder for your health. Regular checks are your superpower to catch problems early. Don't let the silent sneaker trick you. Know your numbers. Ignoring high blood pressure can cause serious problems. Your heart works harder, which can lead to heart failure or heart attacks. Blood vessels get damaged, making it easier for clots to form. This can cause strokes or blockages. Kidneys and eyes can also be hurt, leading to kidney disease or vision loss. These dangers sound scary, but knowing about them helps us avoid them. Treating high blood pressure protects your heart, brain, kidneys, and eyes. With healthy choices and your doctor's help, you can stay on the sunny path. You have the power to protect your health. Now let's make our healthy heart map. Eat more fruits and veggies and less salty, processed food. Read labels for lower sodium options. Move your body every day. Walk, dance, garden, or swim. Find an activity you love. Get your blood pressure checked regularly. And take medicine as your doctor says. Manage stress with deep breaths, music, or time in nature. Every healthy choice is a treasure. Celebrate your progress. You're the captain of your health adventure, and small steps make a big difference. We did it. We did it. Keep taking care of your amazing body.